Let's just dive right into this explainer. We're going to completely demystify the complex world of liver cancer treatments using a clear, logical map. And this is derived directly from the latest medical presentations. If you or a loved one have ever felt completely overwhelmed by a diagnosis, trust me, you are absolutely not alone. Today, we're breaking down a really fascinating, highly informative lecture by Dr. Ryasuhide Motoyoshi to show you exactly how modern medicine is turning the tide. To keep things simple and lower the anxiety that always comes with medical jargon, we'll follow this roadmap. We'll start with the basics of liver cancer, then look at the 2 keys to treatment, explore curative methods, dive into local control treatments, check out the dramatic advances in drug therapy, and finally, look at the future of living with cancer. So, let's get right into it. Section 1, the basics of liver cancer. Okay, so to fight an enemy, you first need to know the battlefield, right? Well, what's truly startling here is that 70% of primary liver cancer cases happen in a liver that's already weakened by cirrhosis. Basically, doctors and patients are fighting a war on 2 fronts. You have to aggressively target the cancer while simultaneously protecting a very fragile essential organ. It's a delicate balancing act.
Which brings us to Section 2, the 2 keys to treatment.
To actually win this 2-front battle without destroying the liver in the process, doctors rely on a specific decision map, and it's governed by 2 absolutely crucial keys. The first key is the tumor stage. So how big is it? How many tumors are there? Has it spread into blood vessels? But the second key is just as vital: liver reserve function. Simply put, doctors have to figure out exactly how much healthy working capacity the liver actually has left to withstand the treatment. And this is where doctors use a system called the Child-Pugh classification. Now, I know that sounds like dense medical jargon, but it's really just a way to grade the liver's remaining health on a simple scale of A, B, or C. They calculate it by checking for things like fluid in the abdomen, jaundice levels, and protein production. So an A means the liver is strong enough for almost any treatment. A C, on the other hand, means options are severely limited. This matrix is the crucial point. Doctors literally use this to perfectly map out a patient's treatment. Up in the top left, where the liver is strong and the tumor is small, that's the easiest to treat. But as you move diagonally down toward the bottom right, where the cancer is advanced and the liver is struggling, the options get highly restricted. Every single patient gets plotted on this exact map to find their safest, most effective path forward. Moving on to Section 3, curative treatments. So let's look at that ideal top left corner of our matrix, curative treatments, where the primary goal is completely wiping out the cancer. When you compare traditional surgery to a newer technique called radiofrequency ablation, or RFA, the data tells a really empowering story. For a single tumor under 3 centimeters, the 5-year survival rates are actually remarkably similar. While surgery is still the standard for larger tumors, this data gives patients a ton of confidence in choosing less invasive options when things are caught early. The RFA procedure itself is highly approachable and basically breaks down into 3 simple steps. Instead of open surgery, doctors sync up real-time ultrasound and MRI imaging. Then, they insert a thin, specialized needle directly into the lesion. And finally, they use radio waves to literally burn and destroy the tumor. It leaves the patient with minimal scarring and a vastly quicker recovery time, a total game changer. Next up, Section 4, local control treatments. But what happens if the cancer has grown beyond just a single small tumor? Well, the focus shifts from complete eradication to controlling the spread. That's where local control treatments like TACE come in. And TACE is fascinating. Doctors thread a tiny catheter into the artery feeding the liver. They elegantly starve the tumor by blocking its blood supply while simultaneously delivering a concentrated hit of chemotherapy right into the cancer cells. In Dr. Motoyoshi's presentation, he shared a mind-blowing case where this procedure dropped a patient's tumor marker, a key indicator called PVKI2, from an alarming 910 all the way down to a completely normal level of 17. That is huge. For even more aggressive cases, like when the tumor starts invading vital blood vessels, doctors don't just rely on one tool. They combine TACE with highly precise, targeted radiation. It's a multidisciplinary approach that acts like a 1-2 punch. And it has successfully made highly advanced, seemingly impossible tumors completely disappear in just a matter of months. Now, this brings up a really pivotal question for this explainer. What exactly are the options when the disease is simply too widespread for localized burning, or there are just too many tumors to individually block their blood supply? In the past, this was a terrifying stage for patients.
This brings us to Section 5, Dramatic Advances in Drug Therapy.
Historically, trying to treat advanced cases repeatedly with TACE would end up permanently damaging the fragile liver. But then came the first major breakthrough: molecular targeted drugs like sorafenib and lenvatinib. Instead of a general attack on the whole body, these drugs act like precision strikes. They specifically block the proteins the cancer cells need to divide, and they stop the creation of new blood vessels that feed the tumor. The catch? These powerful drugs are usually limited to patients who still have a very strong liver function score, a child PUA.
However, the absolute most revolutionary step to date is the introduction of immune checkpoint inhibitors. This shifts the entire strategy from mechanical treatments to sheer biological warfare. Look, cancer cells are notoriously tricky. They physically hide from our body's natural defenses. These new therapies, specifically the combination of atezolizumab and bevacizumab, essentially take the brakes off your own immune system. It allows your body's natural fighter cells to suddenly recognize, unmask, and attack those hiding cancer cells.
And it's amazing to see the dramatic leap in survival time. This right here is the proof of progress. We have gone from a baseline survival of just 7.9 months with no treatment up to 10.7 months with those early targeted drugs, all the way to a staggering 19.2 months with the newest immune therapies. In a very short span of medical history, science has more than doubled the survival time for the most advanced cases of liver cancer. Just incredible.
Let's wrap up with Section 6, the future of living with cancer.
Because of these massive scientific leaps in treatments and immunotherapies, we have to completely redefine what a liver cancer diagnosis actually means today. It's a whole new paradigm. Now, we must be realistic. Liver cancer does have a high recurrence rate, which means it requires careful, continuous observation and regular scans. But successful treatment often results in really long periods where patients feel perfectly healthy. During these symptom-free windows, there are no intense therapies, no feeling sick, just the resumption of normal, everyday life. There's a wonderfully reassuring quote from Dr. Motoyoshi that perfectly captures this modern reality. He says, "With early detection and new treatments, you can continue working and spend time with your family." Liver cancer is no longer viewed as an immediate, fast-approaching dead end. With early detection and the strategic use of this medical matrix, it's become a manageable condition. It lets patients keep working, keep striving, and most importantly, keep making memories with their families. So as we close out this explainer, I want to leave you with this thought. Knowing how structured and advanced this medical matrix has become, how will understanding this decision map empower you, or maybe your loved ones, to face the future with confidence instead of fear? The roadmap to survival is clearer than it has ever been. Thank you so much for joining me, and stay curious.